the final webinar of the CRG webinar series that we have been doing this fall. This topic is ADHD more than an attention problem. And this webinar is designed to help families, to help teachers, to help mental health providers or individuals with ADHD understand the aspects of ADHD that are beyond attention and hyperactivity. As we see families in our office, many times they come in with the young person or the adult comes in with a diagnosis of ADHD, and they may be on medication, but they don't have an understanding of ADHD and the nature of the disorder. And we feel that understanding the nature of ADHD is critical to treating the disorder. Hyperactivity and inattention are just the tip of the iceberg. Before we go any further, I want to take a poll. This will be the only poll we have today, but to find out who is in the audience. So we're going to launch the poll to find out who's in the audience today. If each of you will respond, this will help us know who else is attending this webinar. So if you go ahead and respond, we'll see who's here today. Okay, about 60% of you have voted. We're getting close to 100%. So I'm going to close the poll in just a second. So here we go. About 50% of you attending are parents of individuals with ADHD likely. 24% are teachers, 14% are mental health providers, and 10% are individuals who experience ADHD. So with that, let's go ahead and talk a little bit about ADHD. When we see children, particularly young children, parents often say that they don't see attention problems in their young children. In fact, they note that if they're doing something they enjoy, they can stay with things forever. But for people with the hyperactive form of ADHD, so that's ADHD combined presentation, what we see is the hyperactive and impulsive behaviors emerge before other symptoms of ADHD. So oftentimes the parents feel that the child can pay attention, but they are more hyperactive and impulsive than their peers. The inattention does not seem to emerge until 2 to 3 years later, when sustained attention becomes more necessary and when their peers are able to pay attention longer. And that's often once they're in a school setting. With age, the hyperactivity often declines, but difficulty with inattention and inhibition, which is stopping behaviors or what we say, does not decline. So even though the hyperactivity declines, the inattention and difficulty with inhibition does not. And verbal impulsiveness can become more impairing in adulthood than hyperactivity. So one of the things we know about ADHD is that symptoms will vary depending on the situation. So individuals with ADHD will do better in fun and exciting situations when there's an immediate consequence for appropriate behavior, when they're getting frequent feedback, when what we're doing has high interest. They do better earlier in the day, and they do better in supervised situations. So if we think about school settings, very often we associate preschool and maybe kindergarten with more fun and exciting times. There are more immediate consequences for both positive and negative behavior. We give young children more frequent feedback. There are more interesting hands-on activities. Oftentimes preschool is only in the morning, and we think of those situations as highly supervised. We know that people with ADHD will do worse in situations that are boring, when the consequence is delayed. So, for example, if they do their homework and turn it in and they know they're not going to get it back for a long time, the consequence is delayed. When they don't get frequent feedback, when an activity is of low interest, when it's later in the day, and when situations are less supervised. So we see the symptoms of ADHD vary depending on those situations. A couple of things to remember about ADHD. It is not an input disorder. ADHD is not a disorder that includes difficulty with taking information in most of the time, but it's a disorder of performance. It's not a lack of a skill, but it's lack of doing what we know to do when we need to do it. ADHD is responding more to stimuli than others do, and paying more attention to task-irrelevant information. ADHD is time blindness, and we'll talk about this more as we go on, but individuals with ADHD have poor sense of time. They may be able to tell time, but they do not sense time passing in the same way that other people their age do. So if they're doing something they enjoy, they never have enough time. They have a hard time stopping, and they want to go on doing that forever. But if they're doing something boring, it seems to last forever. People with ADHD tend to live in the moment. Their window of time is very narrow, and they have difficulty in that moment using knowledge of the past at the point of performance. So what that means is that, so if we think about discipline with young children, and we do the same form of discipline for a given behavior over and over, children with ADHD don't learn from the discipline as readily. They don't reflect on the past to bring that remembrance of the discipline to the present. And people with ADHD are inattentive to mental events, so they don't think a lot about things, and they're not attentive to the future. So what we know is that a number of academic difficulties are caused by ADHD. Typically, ADHD does not keep a child from learning how to read. It doesn't keep them from learning phonetics. It doesn't keep a load. They may have another condition that goes with it, such as dyslexia, that affects learning to read. But ADHD does cause difficulty with reading comprehension because people with ADHD have trouble holding that information in their mind to make sense of what they've read. They don't weave the story or the content of the information into their memory. ADHD can cause difficulty with written expression, especially when they're asked to write about things of low interest to them. ADHD has a significant impact on speed and accuracy of math calculation. In fact, the impact of ADHD on speed and accuracy of math is so significant that pharmaceutical companies use timed math tests to evaluate the efficacy of medication. ADHD can often cause difficulty with handwriting, and it can cause difficulty with listening comprehension. So the impact of ADHD on academics is significant. We're going to focus now on some of the areas of deficit in ADHD. And we're going to focus on inhibition, self-regulation, and executive functioning. So let's start with inhibition. People with ADHD have trouble inhibiting the dominant response. And one of those dominant responses, I often, I hope, laugh with families, not at their child, but one of the dominant responses is the tendency of children with ADHD to respond to our questions with no. So for many children with ADHD, no is an example of the dominant response. Now, I always think about my day and how many times I'd like to tell someone no. When they say, "Do you have a minute?" Sometimes I'd like to say no. But as adults or people without ADHD, we learn to inhibit that dominant response. So whatever the person's dominant response is, they have more trouble with inhibiting. Another example is sibling fighting. So it's very tempting for a child with ADHD to inhibit the response of hitting their siblings. Not necessarily because they mean to hurt them, but just because they're sitting there. So people with ADHD have trouble inhibiting the dominant response. They have trouble interrupting an ongoing behavior. So if you're a parent driving 2 or 3 children in the car, and in the back seat you have 2 siblings fighting, and you tell them to stop, the child without ADHD may be able to stop, but the child with ADHD has trouble interrupting or stopping a behavior once it starts. And people with ADHD have trouble protecting the executive functions, and we'll talk more about executive functions, from interference and distraction. So for people without ADHD, they learn how to protect what's going on in their mind from interference and distraction. But people with ADHD have difficulty with that. Let's talk a little bit about executive functions. There's been increasing focus on executive functions in a wide range of literature, from education literature to psychological literature to neuropsychological studies. And we're going to talk a minute about the executive functions, because in people with ADHD, the executive functions don't function very well. So executive functions include working memory and recall, activation, arousal, and effort, internalized language, or turning our external language and keeping it in our head, emotional self-regulation, and planning and problem solving. So let's talk about working memory. Working memory is one of the executive functions that we see a significant negative impact on for people with ADHD. So people with ADHD have difficulty holding information in mind to guide their actions. So an example of how we use working memory in everyday life is if our spouse calls and asks us to pick up something at the grocery store and tells us 3 or 4 things, we use our working memory to remember those things as we get in the car, remember to stop at the store, and remember to get the things that we were asked to get. That's an example of working memory. For people with ADHD, they may get in the car and go right home forgetting to stop at the store, or if they remember to stop at the store, they don't remember to get the things they were asked to get. Now that's referring to adults with ADHD, but if you think about the things we ask children to do or teenagers to do all day long, we can see that they have deficits holding on to information to guide their actions. One of the things that I hear frequently from families is that their child has done the homework, they've made sure that they put it in the backpack, but they forget to turn it in. So they have trouble hanging on to the concept of turning homework in working memory. People with ADHD also have difficulty with multitasking. Now, I know there's been a lot of emphasis on the whole concept of multitasking, and we've been told that no one can really multitask, meaning do two things at once. But I think what I'd like you to think about here is they have trouble going from one task to another and then back to the other task, or taking in different pieces of information at one time and using all of that information to coordinate what they're going to do next. Another area of deficit in working memory is difficulty using hindsight to guide actions. Again, I think we talked earlier about how people without ADHD reflect on the past to try to decide how to guide their actions for the future. People with ADHD don't hang on to that information as well, and they also don't stop to think about it. Another deficit in working memory is difficulty using forethought to plan what we're going to do and adjust our behavior for the future. And as I said earlier, people with ADHD have poor sense of time and cannot estimate time or plan over time. For the parents in the audience, if you have high school children or students, this is the time where your students should probably be starting to study for finals. And that whole concept of starting to study in advance and recognizing that time is closing in on them is hard for individuals with ADHD. What we know is that the deficits in working memory are more impairing with age due to the increased volume and complexity of information. So for young children, adults are very often helping them with their working memory. They're building a lot of supports in, and there's not as much complex information to hold in working memory. But as a person gets older, what we see is that the deficit in working memory is more impairing. One of the studies that has been done, the largest study on ADHD and the impact of medication that's been done was the MTA study. It was done a number of years ago and showed that in young children, medication seemed to have the biggest impact on addressing symptoms of ADHD, the inattention, the hyperactivity, and the impulsivity. But the long-term follow-up of those same children into adolescence showed that medicine didn't have as big an impact, and I think a large part of that is due to the fact that people with ADHD have trouble, more trouble with the volume and complexity of information as they get older and in organizing over time and space. So for those of you who might be middle-aged women in the audience, yes, we do have deficits in working memory as we go through menopause. So just to let you know that people with ADHD are not the only ones who have these symptoms, but decreasing estrogen tends to have cause some of similar symptoms to ADHD in terms of working memory. So let's move on to other areas of deficit. People with ADHD also have deficits in activation, arousal, and effort. What that looks like is procrastination. So we call getting active, completing a task requires activation. People with ADHD are very prone to procrastination, especially when starting on tasks not of their choosing. These are tasks such as homework, cleaning their room, starting a project. They also have difficulty stopping a preferred activity or a preferred task. So it's very difficult for them to turn off a video game to get started on something they haven't chosen. People with ADHD will become sleepy and sluggish on non-preferred tasks. What we often see is that the hyperactive elementary school child begins to be the sleepy, sluggish middle school and high school student. School becomes too monotonous and their brains tend to shut down. We know that people with ADHD have trouble persisting when mental effort is required. They give up easily. And they have trouble maintaining their effort once they're frustrated. So we see that there are deficits in getting started, maintaining arousal, and maintaining effort. One of the things that we see in children, but it persists into adulthood, is that they do not internalize their speech as early as their same age peers. So all of us who've had children or worked with children know that young children, you know what they're thinking because they say it. You can see their thought process because they talk aloud about what they're doing. But over time, children begin to internalize their thoughts, and we don't hear as much of their thought process. Children with ADHD continue to externalize their mind's voice. They talk aloud. They make noises out loud, not in their head when they're playing. But this persists into adolescence and adulthood in terms of individuals with ADHD not using their own mind's voice. They don't do active self-talk. And this impairs their ability to follow through with their plans. So they aren't talking to themselves in their head and using their mind's voice to guide their behavior. It also interferes with reading comprehension and written expression because they aren't internalizing the thoughts that they should be gaining from what they read or maintaining those thoughts for their writing. And this difficulty with internalized language impairs the ability to contemplate events and to reflect on their own behavior. So individuals with ADHD don't have as much active self-talk. They don't play with ideas in their head as readily. And again, this causes them to be responding much more to the here and the now. Individuals with ADHD often have difficulty with emotional regulation. So their emotions are not necessarily inappropriate, but they're made public. So many times when we see young children or school-age children or even teenagers, what we see is their emotions are made externalized. They don't keep the thoughts in their head. Probably most children will think in their head, "Ooh, I hate you, Mom," or "I hate you, teacher," but they don't say it out loud. Doesn't mean they really hate the person, but children with ADHD will externalize their thoughts. They don't keep their emotions private, and they don't moderate them. So what we see in individuals with ADHD is they appear to be much more emotional, and they don't moderate their emotions as well. People with just ADHD and not any other emotional difficulties tend to be very emotional, but they get over it quickly. They don't hang on to the negative emotion. Now, they may leave you behind being angry, but they get over it quickly. And individuals have difficulty with self-motivation. They have trouble setting a goal and keeping focused on that goal and motivated to accomplish it. And they are easily frustrated. So let's move on to another executive functioning in which we see deficits in those with ADHD, and those are deficits in problem solving. People with ADHD tend to be impulsive, so they don't slow down and take an issue apart. They also have trouble planning and generating options toward a goal. So if there is a problem and they can identify a solution, they then have trouble planning and generating ways to reach that goal. We see difficulty with verbal and nonverbal fluency. So what that means is that they have trouble with quickly processing verbal and nonverbal information to get to a point. And they're not as flexible in finding solutions to problems. So what does this mean as a parent, as a teacher, as a mental health professional? Well, first of all, what we know is that people with ADHD need many more positive consequences than negatives. They need more frequent consequences. So compared to others their age, they need a much higher degree of positive reinforcement and much more frequent reinforcement. What we do know is that behavioral treatment or behavior management programs don't last once they're discontinued. So it's important that if you're going to use a behavioral approach, whether it's sticker charts or a clip up and clip down program in a classroom, or rewarding for picking up their room every day, what we know is if we don't continue that behavioral treatment, you won't see the behaviors continue that you want to see. Because people with ADHD have trouble with internalizing their thoughts, information needs to be externalized. So if they can be looking at something that they're doing while they do it, it helps them. One of the things that I think we've seen with technology is that teachers are much more apt to be using a lot of visual information through PowerPoints or different types of technology in the classroom that I think really can help externalize information for students. And time needs to be externalized. What that means is we need to have clocks so they can know how much longer something's going to last, timers so they know how much time they need to spend on something, because the internal time clocks don't work well. Long-term tasks should be broken down into many small tasks. So, for example, if a student is to be writing a term paper over the course of a semester, either the teacher or a parent will need to break those tasks down and give shorter timelines to have them completed. Otherwise, there will not be appropriate effort until the very end when the task is due. Motivation should be externalized. There should be external reinforcements. And we should allow and encourage manipulation, and that means both tangible and visual manipulation of tasks. This is not, the last thing I'm going to talk about on this slide is what most people don't want to hear, and that is that expectations need to be decreased. I don't think that any of you listening today would disagree that we are expecting more and more from our children and adolescents, especially in school settings. I think the curriculum and the expectations are probably at least 1 year ahead of where they were a year ago, maybe 2 in some cases. So we're expecting 8th graders to do things that we used to expect 10th graders to do. Kindergartners to do things that we expected 1st or 2nd graders to do. And while many students can live up to those expectations, individuals with ADHD, regardless of their intelligence, are struggling with keeping up with the organizational and independent skills required in school settings. So both at home and at school, I think we need to think about decreasing our expectations, but ensuring that those decreased expectations are met. So one of the individuals, and at the end of this PowerPoint, you will see that there are some references. Some include Russell Barkley, who is probably the most prolific researcher in the area of ADHD. Dr. Barkley is a psychologist who started out probably 45 years ago working on behavioral programs for individuals with ADHD. And back then they might not have been called ADHD, but people with significant behavioral difficulties. Over time, his research has told us a lot about the executive functioning aspects of ADHD, but also the importance of medication in conjunction with modifying environments. So one of his quotes is, "The more you ask for self-organization, the more he or she will fail. And you are the problem. Why did you ask them to do this? Why did you ask them to self-organize?" And again, I think this gets back to both school settings, but probably also home settings. So what I want to talk about in the remaining few minutes, and then we'll open it up for questions. These are kind of the top 10 things that I try to keep in mind for myself. I try to remind parents, I try to remind educators that I think we need to keep in mind in dealing with individuals with ADHD. And this is for children, adolescents, and adults. For individuals with ADHD, time is the enemy. If they're doing something they enjoy, there is not enough time. If they are to do something they don't enjoy, they will procrastinate or just not do it. So we have to realize that time is the enemy, and time concept is a major problem, and those of us trying to support an individual with ADHD need to recognize that we may have to be the timekeeper. Individuals with ADHD have difficulty sustaining mental effort. I see this time and time again, especially in the teenagers I work with, that after a day at school, they come home and they just don't have any more mental effort. A student without ADHD can be in school all day, ride the bus home, grab a snack, and get right down to their homework. But this is very difficult for individuals with ADHD. And it's why we often need to consider a second dose of medication in the afternoon. While they may not do the work, the medication will help them with their sustained mental effort. People with ADHD have trouble remembering to do what they need to do when they need to do it. So almost every parent I know reminds their child as they leave for school in the morning what they need to do. And the child will say, I know, I know, I know. But when they're at school, they don't do what they need to do. And that's a major deficit in ADHD. ADHD causes a 30% delay in the acquisition of skills requiring self-regulation. And this is something that I point out to families frequently, not as an excuse, but as an explanation. So what this means is that even though a 13-year-old boy may be going through puberty, his voice may be changing, he's interested in girls, he's a great athlete, looks like a man, his ability to self-regulate will be more like that of a 9-year-old. It's not an excuse, it's an explanation as to why we as adults will need to provide more support and assistance with self-regulation. The greater the requirement for self-regulation and organization across time and space, the greater the likelihood for failure. So what we mean there is that as a person gets older, they need to self-regulate and remember what to do across a longer period of time and from situation to situation. The most tangible example I can use is the difference between being in elementary school, where you might have only 1 or 2 teachers, and middle school, where you might have 7. You have to self-regulate across time and space. Probably one of the most difficult times for the individuals we see with ADHD is when they move from high school to college, because time is no longer as predictable. They don't go to school for 7 hours a day and then go home. And there is no one organizing their time and their space. An individual with ADHD performs well once, and we hold it against them forever. This is a quote, or similar to a quote, from Dr. Brown, who has an expert in ADHD, and I think it's so true. And oftentimes I hear parents or teachers say, I know they can do it, they did it last week. But people with ADHD probably won't perform as we expect consistently. Those with ADHD live in the moment. They don't reflect on the past to remember what happened last time, or look to the future to think of the consequences of their behavior. Some of you, if you know me or if I've talked before, you may know that I grew up in a family with many, many people with ADHD. And when I think about this quote right now, I'm laughing because I have a sister who is turning 60 next week and a niece who turned 30 in August, and they've been trying to plan a birthday party which would involve a trip to Mexico. They've been trying for a year to plan it. And so they'll call and they'll start working on it, but it doesn't go anywhere. And of course, I keep saying, our tickets are going to be very expensive if we don't book the flight and plan it now. But those with ADHD live in the moment. They have an idea, it's a great idea, but it doesn't always go anywhere. Or another quote I love is, The trouble with trouble is it starts out as fun. People with ADHD live in the moment. It seemed like fun to sneak out of the house at night, and we didn't think about the consequences of our behavior. ADHD causes individuals to have trouble stopping a behavior in the middle of a behavior. As a parent or a teacher, we are in much better position to make sure a behavior doesn't start than to try to stop it. So an example would be what I see in elementary school boys is a lot of problems occur in the boys' bathroom. It's hard to stop those behaviors once they start, so we might be a lot better off not letting the individual with ADHD go to the bathroom with a group of other elementary school boys. Most of what we know about ADHD is based on research on males, but females with ADHD are just as much at risk for problems in all areas of functioning. I really encourage individuals who are working with or parents of females with ADHD to become familiar with the literature that's being developed in that area. Females with ADHD are at much higher risk for anxiety and depression and other psychiatric issues than males seem to be, but they also have deficits in executive functioning. So I just realized that I don't have my references up. I will make sure they get posted. So with that, I want to open this up to questions. If anyone has a question, they can post it and I will try to respond to it. Okay, so here's one. What strategies or interventions do you recommend to support, grow, or improve self-regulation skills? Well, that's a great question. And I think the first thing I would say is meet the child where they are. So what I mean by that is if you have an 8-year-old who is struggling with organizing their materials to be ready for school in the morning, we know a couple of things. One, they're going to do better with that if an adult's nearby. Two, they may need a list externalized. And three, they may need time externalized. So even though we'd like to say an 8-year-old should be able to put all of their materials together, they may not be able to. So I think as a parent or a teacher, you tell yourself, I need to be nearby. I need to remind them that we need to do this. I'm going to externalize time and externalize the list of what needs to be done. So again, I think, as much as I would love to say that we can rush it by working on it, I think we have to take a developmental perspective and meet them where they are and put the supports in place to help them move forward. Other questions? Well, I guess that means I explained it all very thoroughly. No, I'm teasing. I know that this is sobering information for parents and for teachers, but I think what we need to remember is that it's our role to help the person with ADHD be successful. And if we can be aware of the deficits in executive functioning, in activation, arousal, and self-regulation, I think we're in a much better position to see them be successful. I would encourage those of you who have interest in obtaining more information in this area. Dr. Russell Barkley has a number of YouTube videos that I think are excellent. that I think would be worth viewing. He has a very short video that talks about executive functions. He has some longer ones. And I think he has some excellent information that can help families as well, and teachers. So just as we wrap up early, oh, wait a minute, there's another question here. Okay, let's see. Okay, the next question is, how do we decrease workload and homework expectations? So I think in elementary school, it's very difficult typically to lessen the workload and homework expectations unless the individual has a 504 plan or an IEP, and there's an agreement that, for example, in math, they're only going to do every other problem. I think in elementary school, it's probably imperative that the parent be sitting there with the child. The farther away an adult is from the child, the less likely they are to perform the task. By the time they get to middle school and high school, we often need to be considering whether they should have a study hall, a supervised study hall, or a resource period. And how you get those probably gets beyond what we can talk about today. But I find that even the very bright high school students I work with usually do best if they're not taking a full load. In other words, they have at least one period a day to get some of their work done. I also think that many of the young people I see are, because of the pressure to take AP courses, are taking too many of those kinds of courses. I don't think, and then they don't do well. I think they'd be better off being judicious about what courses they're taking and not try to do so many reach courses, and make better grades in classes that might be slightly below their intellect, but more within the realm of what they can get done. Okay, so this is a question, whoever's asking this question must know the question I get, the statements I get from parents in my office every day. The question is, do ADHD kids have a propensity for lying, and what is the advice on that? And so what I would tell you is that kids with ADHD lie a lot, and most of them are little white lies. They're not necessarily lies that are going to hurt anyone else. They lie about things like, did you brush your teeth? Yes. Did you wash your hair with shampoo? Yes. And they didn't do either of them. So individuals, children with ADHD tend to respond impulsively in a way that will get them out of trouble. So one of the things I talk to parents about is trying not to put them in a position where they will lie. So instead of saying, did you brush your teeth? You say, let's go check your toothbrush, or let me smell your hair. Typically, individuals with ADHD aren't very good with forethought, so their lying is not usually a manipulative, well-planned out lie. It's an impulsive white lie. So whenever we can, I recommend that you take away the need for them to lie. And then, of course, if they aren't truthful about something important, there should be a consequence, but I think it should be like, did you turn your homework in? Yes, and they didn't. You know, make sure that it's not a life-changing consequence, because it won't mean anything. I think you should take away privileges for a very short time so they can earn them back. Otherwise, you will be taking everything away and you'll be miserable. Okay. Here's another question. and I think there's some questions about IEP. Okay, should children with ADHD be expected to perform at grade level? Well, ADHD alone is not a reason that a student cannot perform at grade level. They may have difficulty demonstrating what they can do without the support and assistance to get work done, to get it turned in. But typically ADHD is not a reason that children would be below grade level in their skills. They just may not consistently demonstrate their skills by doing and turning in the work. Okay, any specific strategies for getting ready and out of the door in the morning? Well, first of all, if the mother is the one who gets the kids up and ready for school in the morning, I'm going to tell you, you probably need to get up earlier. You probably need to get yourself ready first, because you will probably need to be near the young person with ADHD as they get ready in the morning. So many times what this means is I encourage parents to have the children up, have their clothes laid out the night before, bring them downstairs if the mother's downstairs or in the kitchen cooking, have them get ready near you, keep a toothbrush in the downstairs bathroom or the bathroom near the kitchen, because the farther away the child is from you, the more likely they are to get distracted and not stay on track. So, I think you have to allow yourself more time and the child more time, and keep them near you, and you can have a list, but you may need to prompt them on that list. Can you suggest strategies to help teens do their tasks around the house? Oh man, these are tough questions. Well, first of all, I would be very clear about what their tasks are. I would try to schedule the times into a natural point in the week. So, for example, cleaning the bedroom, that may be what gets done right before Sunday night dinner. So there's a predictable time that's going to be done, and a predictable set of expectations. So following a task like clean your room may be too open-ended. They may need to know, have it written down. They need to bring their laundry down. They need to put their clean laundry away. They need to dust their shelves, whatever the responsibilities are. And that at the conclusion of that might be when you give them their allowance for the week. Can you include those, Barkley videos? Yes, I will. Let me tell you that I think what happened is I pulled up an old version of this PowerPoint, and so I'm going to repost the other version that will have that link in it, as well as the other links. So I will put that up there. Are there any advances in studies with respect to prevention or curing ADHD similar to advances for Alzheimer's and dementia? Good question. I am not aware of any research that's ongoing for cures of Alzheimer's. We do know that it's highly hereditary in most cases. I think the prevention is probably coming in things like encouraging parents not to smoke during pregnancy. Maternal smoking during pregnancy can cause ADHD, so obviously that's something that's preventable. We know prematurity puts a person at risk for ADHD, so I think obviously taking care of the mother during pregnancy and trying to prevent prematurity. So about 20% of cases of ADHD are acquired by things like maternal cigarette smoking, prematurity, difficulties during childbirth, accidents, but about 80% are genetic or hereditary, and I don't know of anything that's pointing towards a cure for that. Let's see, one last question. Even with external reminders checklists, I still find myself giving reminders and nagging very often, suggestions. So a couple of things. I think what I would tell yourself is to just take the emotion out of it and know you probably need to give reminders. If you're an individual on this presentation who has ADHD, what you probably know is that you need reminders. If you have a spouse with ADHD, you know they need reminders. As people get older, they need fewer, but I think just know that you need to probably simplify expectations and know that you're going to give reminders. The one last question I will address is, do children with people with ADHD have trouble waking up in the morning? And the answer is yes. So people with ADHD often have trouble excuse me, turning their brain off at night, and they have trouble waking it up in the morning. Now, not all people with ADHD, but it's very common, especially the older the person gets, like teenagers. So we want them to learn to get up on their own, but I think the consequence of missing school and failing is probably too big of a consequence when they're still in high school. But it is a problem as they go to college. So I just want to thank you all for being present today. I know we covered some big concepts, and I just hope that it's helpful for you in terms of thinking about how to support the individuals with ADHD in your life, whether they're your child, whether it's a grandchild, whether it's a student, or whether you're a mental health provider trying to assist families. So I want to thank you all. I hope everyone has a good holiday season, and thank you for your valuable time today.